love that you want to tell us why you chose to have your facial rejuvenation. What made that decision for you, or what brought you to that point?
I had one moment when I was 40 where my phone was on my lap and I was sitting in the car and the camera opened up and I saw my face at this angle.
Oh, the worst angle in the world. Not good
You
for
understand me?
anybody.
And it was neck. It was all neck focused, and I was like, I'm getting a neck lift like tomorrow. I have to figure this out. And it started a 10-year basically research project.
Wow, 10 years, really?
Yeah, because I did it 2.5 years ago, so I was 51 when I decided to finally pull the trigger on that. And thankful that I waited, thankful that I had really good doctors tell me to wait. So it's been a learning experience, and I just feel like I wish I was able to talk to more people openly about it, to have questions answered so that they could advise me. And I've just been thinking about it for a few years, and I just decided that I wanted to share, answer questions, help women out, anybody that has questions. So it's not for everybody, but I feel like it was a choice that I wanted to make. I feel really young inside, and I think when you look and all of a sudden you see yourself aging, there's some things that you can't control. We can't control gravity. Like, yes, we can work out. Yes, we can control our diet, and we can take care of ourselves in that way. But what's shown on the outside, when you get down to it, it's if you want to change that, it's surgery that's going to have the biggest impact. I did fillers, Botox, like I'll still use Botox, but I learned a lot about fillers from the doctor also that did the procedure, and I actually had to dissolve a lot of the fillers before I did that. So
what was it like to have fillers dissolve? Because so many.
Honestly, it was pretty easy. Like within weeks before, you just go in and they inject something that dissolves it, and so. But just knowing that had I done a fat transfer or learned about like fat transfers into the face and using your own fat, that just goes a lot longer and more of a natural look. So yeah, I just decided I wanted to share it.
I love that you're sharing and talking about it. What was it like once you decided, I'm going to do this? Who did you decide to do it with? Who is your doctor of choice? How did you find someone? There's so many plastic surgeons out there.
Yeah. I started with the docs that I did locally that I did fillers with, went and had appointments with them. I mean, there's a price range. You can go from maybe $15,000 up to $200,000. Wow. So you have to find what's in your budget, find the good doctors within your budget. But it's also learning that doctor, learning the way that they do the procedure. There's different procedures, like facelift is a pretty generic term. There's so many smaller procedures that happen within that you have, or you have done in conjunction with fat, used as filler to also supplement. So
it's nice to know our fat can be used for some good out there.
Yeah, exactly. No, I actually sometimes now when I want to go and get filler, I'm like, can we just get a little fat out of there? It's not as yeah, just repurpose it in different.
Do you hear that, fat? We have some good use for you coming up.
So once you found your doctor or two that you wanted to consider, did you have a list of questions that you asked them? Like, what was your prep work before actually choosing your doctor? Is there anybody that helped you with that? Like, how do you know what to ask?
I thankfully did have a friend that had started doing some of the research with her mother, and she told me about the Beauty Broker. I haven't used her, but that was a great resource that a friend of mine has used just to learn about the different doctors that are out there and the procedures that they specialize in. So there are brokers out there that do a lot of that research for you. But it was a matter of scheduling, and I can tell you sometimes these appointments, it could take 10 months to get a consult.
Wow.
And you're FaceTiming with them, sending in photos. A lot of it is via, Zoom or telemedical,
Yeah.
so you can have those consults with the doctors. But meeting them, just talking to them, learning about how they prepare you for it, how they prepare you afterwards. I wanted to make sure that I was going to be able to visit them in person. For me, it was important to see them. Like, even though I did it in California, I live in Nashville. I wanted to make sure I was able to visit, have time with them. They had time for me, and I wasn't just a number that was kind of going through their operating room.
So you've chosen your doctor at this point out in California.
Yes.
What did you have to do once the date was set and so forth? What did you have to do to prepare for this surgery in California? What steps did you take?
So Dr. Karam and his team were wonderful. Probably 6 weeks before the procedure, they give you a diet to follow to help your procedure, help your healing. They'll give you the medication that you should stop taking, some immunity supports that you should be taking to start bringing into your diet. So doing it properly, you have, I think it's at least 6 weeks planning up to that. They offered care afterwards. Thankfully, I had my mother. And also my son and his girlfriend were there. My family was super supportive, but they came, stayed, and took care of me.
So you told your family ahead of time. What
I
was that
did.
like?
I did. It was a little. I mean, my boys know I get procedures done, and they know that I want to look as young as I feel. So yeah, you just have to let them know. But they were supportive.
Good. I think
Yeah.
something, I think this is a big deal, and I don't mean that in a judgmental kind of way. I think it's a big deal, and it should be celebrated. And of course, you would want your loved ones to be on board, right?
Yes.
Yeah.
And they were. Yeah, it was great.
Oh, good.
Yeah.
So you're in California. Is there anything that you had to do physically to prepare your body so it could be in the best shape or whatever in order to have the surgery? Is there anything?
No, I think it was more about diet. I didn't start any particular exercise regimen. More about diet, cleaning up the alcohol, so you're healing, and just don't drink before surgery.
Let's start with the day of procedure. Do you not want to talk about that? What it's like to go in?
Happy. No, I'm happy to talk about all
Okay.
of it, and yeah, if anybody has questions,
Okay.
let me know. But I met with him the day before, and then the day we went in. So one of the reasons I also chose Dr. Karam is he does not put you completely out.
Wow.
And I think not having all that anesthesia in your system helps you heal faster. I'm sure, he has his own medical reasons for it, but I was really happy about that. So you go in, they give you a little, make you comfortable twilight, something. And I was so happy afterwards.
Wow.
Even like I don't know if they put some happy medicine in the medicine that they give you, but I feel like for a good week afterwards, I just felt great about the healing. I was excited about the healing.
That says a lot about that choice, because normally if you have anesthesia and you are out, it takes a couple of days at least to work that through your system.
Yeah, that, and worried about just being depressed or regret of the decision, or did I make the right decision? I think I was so prepared. I was looking forward to it for the better part of 10 years. I felt like I was in good hands, had done my research, so I was excited for it. I knew all the, what was going to happen that week following, had the support of the family. I chose to stay in California near his office for all the visits, so I was completely comfortable, and that team of doctors, like the doctor and the nurses and his staff, made me comfortable the entire time.